Assalamualaikum, myself Waqar Andhawa, and I welcome you on the platform of telemedical education. Telemedical education basically student-based nationwide e-platform है for medical community. हमारे पास प्लेटफॉर्म में बहुत सारे प्लान्स हैं, बहुत सारे प्रोजेक्ट्स हैं, बहुत सारे प्रोग्राम्स हैं जिसमें स्पेशली मेन एम्फसाइजिंग मेडिकल एजुकेशन फॉर मेडिकल स्टूडेंट्स एंड मेडिकल कम्युनिटी. तो वन ऑफ द प्रोजेक्ट इज मेडिकल रिसर्च. मेडिकल रिसर्च का प्लान हमारा ये है कि हम अक्रॉस पाकिस्तान डिफरेंट कॉलेजेस में सोसाइटीज़ को अप्रोच कर रहे हैं और डिफरेंट मेंटोर्स को जो हमारे गाइड हैं स्पेशली मेडिकल कम्युनिटी में उन्हें अप्रोच कर रहे हैं, उनसे रिक्वेस्ट कर रहे हैं कि वॉलंटरी बेसिस पे वो हमें आएँ, गाइड करें और हमें बताएं कि रिसर्च क्यों इंपॉर्टेंट है. ठीक है. टेलीमेडिकल एजुकेशन इनवाइट्स यू ऑल द पीपल अक्रॉस द ग्लोब टू ज्वाइन टेलीमेड्सएडू रिसर्च प्रोग्राम. ठीक है. अभी तक हमारा डिफरेंट सोसाइटी के साथ कोलैबोरेशन हो भी चुका है. सो आवर फर्स्ट सेशन इज विद वर्दी डॉक्टर जेविद इकबाल सर. आई वेलकम यू ऑन द प्लेटफॉर्म ऑफ टेलीमेड्सएडू. ठीक है. So here with me is Amna Anwar, TeleMedsEdu research head. So over to you, Amna.
Assalamu alaikum everyone. My name is Amna Anwar. I'm head of research at TeleMeds Education. What I'm here to tell you is about the program, how we've initiated it, and what's our future plans and goals. So what's happened is we've made a program starting with the mentors that were originally me and Waqar, and then we've made a group. We've established a group of 20 students, and by interviewing them and giving them a role to have in the research group, we've had a group full of 25 students in total, 20 students who are medical and dental and pharmacists. So what we basically have is we've set up webinar sessions, and these are the sessions that's going to be happening every weekend, every Saturday, where everyone who are the guest speakers are going to be discussing key elements about research, especially during the undergraduate course in Pakistan. We've also set up Zoom meetings where we taught classes to a series of Series 1, Series 2 and Series 3, where I've taught them how to undergo research. We're starting from simple methodology to going to synopsis, what is a thesis, then going on to the data collection and then data analysis, and then how to write a conclusion. So I've given them and provided them some sort of idea to that group. Next, we're willing to span this throughout Pakistan, so having to collaborate with other societies, other programs in all of the universities in Pakistan. That's our future aims. Over to Maurice.
Excuse me, I can be called in Operation Theatre anytime. So I think if you allow me, let me share my ideas for next 20 minutes and then you can continue. Sorry for this interruption. Right. So thank you very much, Waqar, Amna, Maurice, and also Bina from Multan, who actually involved me in this project. So, well, I was in England a few years back, and my khala, she said that we'll take you to a restaurant, which is a Pakistani restaurant. It's very famous for its dal and karai and all those things. So we, went with a half-an-hour drive to somewhere. There, what I saw was that there was a young lady, probably she was a teacher, and there were young kids. They were sitting on the road, by the side of the road, and they had small papers in their hand and they were writing few things. So I was very curious, and just I asked from the lady that if you don't mind, who are these kids? She said, I'm their teacher and these are the students. I go, which class? She said, if you compare it with Pakistani thing, they were class 2, class 3 students, boys and girls. And they was just sitting, on the floor, just resting against the wall, and they were writing few things. And I said, what are they doing? She said, this is their research class. And I said, research? So can I talk to them? She said, okay, you can talk. So I just talked to a young girl. I said, what are you doing, little girl? She said, I'm doing research. I said, okay, so what research you are doing? Please remember, she was 6 years old girl. She said, my research project is to count down the total number of cars which are coming from the east and going to the west, and then to see how many of them are white colored. And then I asked from another boy, what are you doing? He said, I'm also doing a research. I have to just find it out that how many trucks are coming from west side and going to the east side, and what are their colors. So this was their research. I don't go in a detail of that, but this is what they were doing sitting there at class 3. Research is not a rocket science. Research is not something which requires a philosophical ideas. Research is just like keeping a record of scoring when you are playing a cricket. Just imagine that a PLS match, or Pakistan Super League, PSL cricket is going on, and someone is just throwing the ball out of the boundary regularly, and there is no one who's recording it. How funny it will be. How funny it will be that someone has hit 6 sixes and 12 fours and nobody's recording it. So research is simply a mindset, which means whatever you are doing it, just record it, right? And sometimes,
right.
basic form of research is just recording what you are doing. I just did a laparoscopic cholecystectomy, and I also did a hidradenitis suppurativa excision from the axilla. Just record it, right? And when you just record it, and after about 1 year, you just analyze what you have done. That's what research is, and it's a very simple form, right? And when you are little more into research, you can do intervention. There was a group with which you did this. For example, there were patients who had hemorrhoids, and there was another group who had hemorrhoids. In one group, you did stapled hemorrhoidectomy. Another group, you did an open hemorrhoidectomy. And after, when you have got 50 cases in this group, 50 cases in this group, you just analyze that what happened to them. And then you make a result. I'm just trying to oversimplify it. So research is basically not something which requires a very philosophical ideas. It is just merely a mindset that whatever we are doing, we need to make a habit to record them, number one, and then very keenly observe them, that how that group of people, they are behaving, right? So this is research. So basically, this has to be taught to us in our primary schools when we are toddlers. There has to be a mindset which should just teach us what research is. Mind, even if we have not learned it up to, and you are in a right nice malleable phase of your life where you can actually have a mindset of a research incorporated in your studies, and then you will see that by the time you will be actively involved in clinical study, you will have your own generation of knowledge. You will generate your own knowledge on the form of the evidence. So this is what research is. And what I honestly feel is that as a medical student, whatever you are doing, there has to be a record. Your colleagues, Amna, Bakar, Bina, Mughis, and others, and I'll also be, inshallah, Aziz, will be assisting you in that. We will just share with you what is the formal way of actually doing the research, in which we will talk about what is research question, how you collect the data, how you make a study design, how you do the statistical analysis, how you publish them, how you actually write them, how you collect the references, and all those, and what is the sample size, and how do you what are the sample collection techniques and instruments required for sample collection. So we will all be discussing all those things. The only message in this short period of time which I want to convey to you is that please try to keep a record of whatever you are doing. Moreover, the scientific research, which is an objective research, which is called quantitative research, is mostly clinicians, they do that. But you as a medical students can also do a qualitative research, which is a superior form of research. Like quantitative research, I just gave you an example of hemorrhoids, and there are two types of tablets, tablet A, tablet B, and you just give it in a patient with headache and then see which one is more effective. This is how you do a clinical research. You produce numbers and you compare them statistically. But you as a medical students can also do qualitative research. Qualitative research are those which actually try to find out the human behavior, which try to find out the phenomena and the reasons for happening of certain phenomena. For example, what is the mindset of students what are the emotional impact of failure of failure of FSC students who are not able to get admission in a medical college, for example. Now, this study will be a qualitative study, and there are separate techniques and tools which are required for qualitative study. I really apologize. I actually forgot, and I was just operating when Binish just called and my son picked the call, and I had to chip in. I just came back, and my assistant is closing the abdomen. I have to go back. So for this short period of time, let me summarize what I have said. Number one, each one of us can learn research. Each one of us must do the research. Research in its basic form is nothing but just keeping a good record of what we are doing. And then when you design research, you actually can make a study plan which becomes a more higher research, in which you intervene and see the result, in which you compare different things. And sometimes the variables are more than one when there are multivariant factors affecting on something. For example, you are doing a research on hypertension, why the incidence of hypertension is increasing in this population. So there will not be one factor you will be studying. There may be obesity, there may be hyperlipidemias, there may be family history, there may be smoking, there may be addiction, there may be stressful, blah 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 blah. So when there are variants are different, then there are different techniques. So I haven't told you anything technical about it. With this talk, I just want to emphasize that be ready for that. And inshallah, shortly, I'll just make a plan with Waqar, and we will have a workshop where, inshallah, I will try to share my experience that how a medical students can actually launch a workshop. That workshop is about 3 hours. I would like that it should be done in person and not online, because online it is difficult to be very interactive. However, I will send a link to Waqar or Binish where I conducted the same workshop with PGRs of Services Hospital Lahore. They invited me over there. That's about 2 hour 40 minutes workshop. Ji, bula le. There was 2 hour up over chale jayega. There are 2 hour 40 minutes workshop which was आइए तशरीफ लाइए. सर मैंने 5 मिनट लगेंगे बस. तशरीफ रखो. तशरीफ नहीं, तशरीफ रखो. नहीं सर मैं कर रहे हैं ना, लाइव चल रहा है सेशन. बेटा चाय सर को दीजिए. चाय सर के. So it was it's 2 hours and 40 minutes session. I will send you a link. Now before we do that live workshop, I will request that you just pass on that link to all of your colleagues, and they should just go through it so that they can have
देख चुके हैं. वो YouTube पे पब्लिक ही पड़ा हुआ है. वो पब्लिक पड़ा YouTube पे.
You just write research methodology Professor Javed Iqbal, and you can just get that. You can just, it's a 2 hour 20 minutes workshop which I conducted with PGRs and registrars and senior registrars of Lahore Services Hospital Lahore. So just go through that. Maybe you do it in bits. You may not just it's very difficult to concentrate for good 2.5 hours, but just you go through that and then have a taste of it, and then we will plan and we will conduct that workshop. In the meantime, my message is that just becoming a doctor who can just tuck in the injections, a person who can do an operation, a person who can prescribe the medicine, that is not good enough now. This is just utilization of already existing knowledge. But what is demanded from us is to generate new knowledge, and generation of new knowledge, creating a knowledge. It is not just utilization of knowledge, creation of knowledge. And creation of knowledge is only possible through research, right? So that's all from my side. If you have a couple of questions, I'll be very happy to answer, and then I'll say goodbye to you.
जी आमना question.
I'm sorry, I can't hear you.
आमना अब स्टार्ट करें. मुगीज का इंटरनेट इशू है.
Yeah, Waqar, I think you carry on with your discussion. So just excuse me, I beg leave.
ठीक है, हम वाइंड अप कर लेते हैं. नेक्स्ट इंशाल्लाह जब सेशन स्टार्ट करेंगे.
Lovely.
ठीक है सर. Thank you
for having
your time.
Thank you for having me.
Thank you so much for your time. अच्छा गाइस, बेसिकली ये हमारा मेन प्लान था. सर अब बिजी थे, चलो स्केड्यूल की वजह से थोड़ा एडजस्ट हो गया. मेन आइडिया हम लोगों ने आपके साथ शेयर कर दिया है. सर ने जनरल बेसिक बातें भी बता दी हैं और मेन थीम भी बता दिया है कि ये किस तरह हम चीजों को लेके चलेंगे. ठीक है, मुगीस मेरे साथ था.
Okay, can you hear me?
Yes, Amna, you're audible.
Am I
अच्छा.
audible?
Yes, yes, you're audible. Thank you, Sama Khan. अच्छा, थैंक यू सादिया. अच्छा देखो यार, बेसिक प्लान ये था. थैंक यू सानिया व्लॉग्स, थैंक यू सबीर अली, थैंक यू सो मच, थैंक यू ऑल गाइस फॉर सपोर्टिंग टेलीमेड्स एडियो. बेसिकली हमारा प्लान ये है, आमना अनवर मेरे साथ हैं, टेलीमेडिकल एजुकेशन की रिसर्च हेड. मेन प्लान ये है कि वी आर इनवाइटिंग ऑल द रिसर्च सोसाइटीज ऑफ डिफरेंट मेडिकल कॉलेजेस अक्रॉस पाकिस्तान, फ्रॉम एवरी मेडिकल कॉलेज. अगर आपके कॉलेज की सोसाइटी है तभी हमें ज्वाइन करें, नहीं है तभी हमें ज्वाइन करें. बेसिक हमारा प्लान ये है कि हम रिसर्च वेबिनार्स कंडक्ट करेंगे जिसमें बेसिक एम्फेसाइज करेंगे, जस्ट टू एम्फेसाइज, जस्ट टू क्रिएट अवेयरनेस अमंग स्टूडेंट्स हाउ टू प्रोड्यूस लिटरेचर. हमारे यहाँ मेडिकल कम्युनिटी में, मेडिकल स्टूडेंट्स में एज सच रिसर्च का ट्रेंड नहीं है, बहुत कम रिसर्च होती है. ठीक है. वेबिनार्स के बाद जो हमारे कोलेबोरेशन में होंगे वेबिनार्स, उसके बाद हम लोग इंशाल्लाह मूव करते हैं नेक्स्ट जूम सेशंस की तरफ. जो डॉक्टर जिशान हैं फ्रॉम अमेरिका, ही सपोर्टिंग अस मच, अल्हम्दुलिल्लाह. डॉक्टर जवेद इकबाल सपोर्ट कर रहे हैं. बाकी बहुत सारे डॉक्टर, डॉक्टर आमिर फुरकान साहब हैं, डॉक्टर अजहर हैं,
Yeah.
बहुत सारे डॉक्टर्स हैं जो सपोर्ट कर रहे हैं. तो हम इंशाल्लाह अकॉर्डिंगली लॉन्च करेंगे. आमना आपके लिए थैंक यू, नादिर थैंक यू, मोर पावर टू होल टीम, थैंक यू. आमना आपको कुछ कहना चाहेंगी? थैंक यू फिजान.
Yes, actually, I just want to say a couple of things, especially starting with the fact that in Pakistan, we've actually have a deficiency of this research idea about having to do this in an undergraduate degree. We think that whatever your degree is, you should just complete that and nothing else. In fact, doing something along with your degree increases your ability, increases your professionality, and it also has something to add onto your CV so you can use later. The benefits you'll see in the long run. A lot of people want to see this as a short-term benefit, but actually it's something that you would see in the long run. Another thing we would like to suggest is anyone who's doing the societies, anyone who has societies or programs like Telemeds Education Research Program, if you could just get in contact with me then afterwards, that would be great, so we can do some collaborations. That was what I've discussed in my plan and future plans and motives. Anything that you'd like to add, Wakar, before we close this off?
थैंक यू सो मच, थैंक यू सो मच फॉर योर एक्सप्लेनेशन. अच्छा बेसिकली देखो, आमना ने सारा आइडिया आपको, सारा प्लान समझा दिया है. आप लोग ओपन हार्टेडली, होल हार्टेडली आप ज्वाइन कर सकते हैं हमें. ठीक है. टेलीमेडिकल एजुकेशन रिसर्च टीम आप आमना से कोऑर्डिनेट कर सकते हैं. थैंक यू सईद फॉर योर अप्रिसिएशन. अच्छा तो आप लोग ज्वाइन करें अपनी रिसर्च सोसाइटी के थ्रू प्रोफेशनल वे में. अभी तक हम लोग पीएमसी से कोऑर्डिनेशन हो चुके हैं, निश्तर में कोऑर्डिनेशन हो चुकी है हमारी, अमीरुद्दीन सोसाइटी में कोऑर्डिनेशन और डॉ यूनिवर्सिटी से कोऑर्डिनेशन चल रही है. इसके अलावा जो दूसरे कॉलेजेस हम लोग उन्हें भी अप्रोच कर रहे हैं, रिक्वेस्ट कर रहे हैं. We warmly welcome you on the platform of telemedical education. So let's do it together collaboratively. So stay connected, guys. Best of luck and best wishes. Let's do it from the forum of telemedical education with aim empowering medicos professionally. So thank you all for listening, for supporting, and for all your time bearing us. Thank you so much. Allah Hafiz.
Thank you so much.